Hey, I'm Jason Pozner from Boca Raton, Florida. I am your guest host today for our first episode of No Spin Live in 2021. Okay, we have two wonderful experts with us, Ned Snyder from Austin, Texas, and Chet Mays from Louisville, Kentucky. All right, guys. So, the first off is Happy New Year. Did you guys have an exciting New Year? Mine was quite boring. We stayed home and watched TV.
We were in Colorado, so we skied
Wow.
for kind of the duration over Christmas and New Year's. So, but in terms of partying it up or going out or doing anything that sort of celebration-wise was non-existent for us.
How about you, Chet?
Yeah, no, I wish I had a great story on 2021, but I was in bed before the ball dropped. Did it even drop this year? I don't even know. Like, I got 3 young kids. I was like, I gotta go to bed early because we're gonna be ready to play at 6 a.m. So it's uneventful, but eventually I'll sort of round myself back and get to some big celebration someday for sure.
I asked all my patients, and pretty much everyone said this is probably the lamest New Year's that they've ever had. So
yeah, oh for sure. I didn't even go to dinner. I didn't even have dinner or anything.
Yeah, I cooked some steaks, but that kind of brings us into like, okay, welcome to 2021. Mm-hmm. We know this, the vaccine has been recently introduced and is starting to roll out in different cities. And then we're hoping that maybe next year we'll able to have some better celebrations, but wanted to know how you guys feel about the vaccine and things like that. Just for FYI, I have an appointment 8 o'clock tomorrow morning for my first dose. And my hospital has the Moderna, and we ordered the Moderna for our office because we don't have the refrigeration for the Pfizer. And it's hoping to come, hopefully by this week or next week, we'll have it for all my staff, those of them who want to take it. So that's what we're doing.
I'm super pro-vaccine, so I got the Pfizer vaccine, I guess, on the 18th, maybe something like that. So I get my second dose this Friday.
Oh wow, you got very early. Any reactions to it?
I get your muscles a little sore, but besides that, nothing. I hear after the second one that some people get some fevers, so kind of anticipating that. Whether it'll happen, I don't know. Most of our offices received their first vaccine. I got the Pfizer. Most of our office got the Moderna. But yeah, so I mean, it's really
state to state. I'm in Kentucky, in Louisville, so we have the Ohio River that separates us from Indiana. And Indiana, they've been flowing that vaccine out like water, whereas Kentucky, they haven't even offered it to healthcare workers yet. Luckily, we have a spa over in Indiana, so we've been able to utilize that to get some of our employees vaccinated. But I think they're a little behind the ball here already, and it's Kentucky. Yet? I will get it. I haven't. Dr. Calabrese has had it. He had his first dose last week. I'm sort of dragging my feet because I actually have antibodies to it. I was exposed at some point. I never had COVID. I never had symptoms, but I tested my antibodies and I have the IgG. So I've sort of dragged my feet on getting the vaccine, but I will get it. Yeah.
I'm like, for the people who have positive antibodies, I don't really think you need it. Is there any proof that it gives you any increased longevity of antibodies?
No, I don't know that there's any known increase in it, but the variability at which people hold on to the antibodies hadn't really been studied, and at least a little bit of the limitation of the studies has been that it looks like it's variable. Some people have not held on to antibodies as long as we'd like.
But my community, our community is not a pro-vaccine community, but our office is for sure. And but there are a lot of people in Kentucky who just don't want it, don't believe in it, and so it's been tough to sort of navigate those waters as well. But if you got to believe the science and the studies and everything and the medicine, and we're scientists, all of us. So
we all see a lot of patients on a daily basis. So to me, it's like just face to face. I mean, if I worked from home and didn't really see anyone, I'd be like, maybe I don't care. I'll wait.
Yeah, right.
I could see 60 some patients in a day. I'm like, we need to get covered.
Yeah.
Are you guys testing your surgical patients?
Yeah.
We are still. Yeah. Test everybody.
We're probably one patient a week we're canceling because their COVID comes back positive.
Same thing.
Yeah.
Same thing here. We
actually
have some regular flu patients too now. Non-COVID regular flu.
That still exists, the flu?
Yeah. We canceled one yesterday.
It hadn't gone away because of COVID.
Yeah, right. Yeah.
But this kind of brings into like another question, because with the vaccine, there have been some reports that people are having some reactions to their fillers with the vaccine. So I figured we could discuss this.
Yeah, we actually we got a couple of patient calls when that was released about, I think I saw it through USA Today, I think is where I first saw it, but it's been put through all the news outlets about, cosmetic patients who have facial injectables or having swelling after their, the Moderna vaccine. So we got quite a few phone calls. So we sort of stepped back and looked at it. and realized it wasn't really that big of an issue. What was it,
like 4 people, right?
Yeah, 4. I think when I saw it was like 3 in 30,000 or something. And 6 months after their injectable, I was like, well, there are some patients who 6 months after an injectable will get some swelling, or they have dental work, or a pimple or something, get some swelling around their filler. So didn't take too much into that, but it definitely put it on the radar, and you got to educate patients. Like you said, you filmed something today for your patients about it, Jason. So it
still beats getting COVID. It's still way better than getting COVID. Yeah. And I think it seems to be pretty transient and short-lived.
Have you seen anybody with this yet?
No, but I've kind of followed the...
Yeah, they all resolve with steroids and antihistamines.
Yeah.
All 3 of them. And I don't want to know what filler was used, where it was put. Like, I think those things can determine what the body does.
So to me, like, I just said, like, okay, I told my staff, all right, so let's have some extra. We make sure we have Benadryl around the office. Yeah. So if someone seems to call us with a reaction, have some Benadryl, and just on the safe side, I mean, just since we're going to start doing some of the vaccines in the office too, just make sure we have some epi around. Just God forbid there's any problem that needs some epi, but we have Benadryl, and I haven't not seen this personally yet, but if it happens, we know how to answer. But we did, like you, Chet, we got a lot of calls about it over the last day or two. All right, guys. So, I mean, I think we're all kind of on the same page with this vaccine stuff. And, if someone, as we get more information about the fillers and the vaccines, I think we'll definitely keep an eye out and be able to get on PSC, and maybe we'll have a segment devoted exactly to that. But right now, we're in the same boat as the patients that we saw it on USA Today, and we haven't seen too much personally yet.
No, but not at all.
I think we'll talk a little bit about a more fun subject now. And there was an article online about how some of the housewives, especially the Potomac housewives, were talking about their plastic surgery and whether they had it, they didn't have it, and people online were talking about it. So, like, not that I really care about it, but Ned, what do you think about it?
Well, first of all, most of the stuff that they're doing is all pretty mainstream. It's just stuff that to us is certainly really mainstream, which is, I think there's a lot of Botox and fillers and just injectables in general on the show. Some of what that article alluded to as well is whether people actually had surgery or not, and there certainly are some. And there's breast implants have been discussed, as well as facelifts and admissions and denials and whatever. And who knows? I think that it's probably not that hard if somebody goes back through some photos of older episodes and can kind of figure out what people had. But the end point is that to me, it doesn't really matter. I mean, I think this is all.
You care about as much as I
accepting to us.
Right. And how about you, Chet?
I mean, I've watched all 5 seasons of it. It's my favorite. No. But yeah, I mean, these people have their lives documented. So you're going to sort of look at it with a fine tooth. You have a picture of them 5 years ago, and you look at them, 5 years ahead of time, and you're going to see these differences. And, people want to speculate. But if you took pictures of me 5 years ago, or you guys 5 years ago, you're going to see little things. And
it's in my eyes.
See, there you go. Right. That's all people are talking about here in Louisville, Kentucky is, Pozner's eyes down in Florida. That's all we talk about up here.
I think like we got like what we're all saying is like, look, there's a lot of important stuff going on in the world today via political and COVID and all that stuff. And the most important thing you talk about is whether some woman on the Housewives show got breast implants or got her implants taken out.
Yeah. But this is the line of work we're in, and if people are entertained by that and they have questions about breast augmentation or rhinoplasty, I think it just generates discussion for us. I don't know about you guys, but even with the pandemic, cosmetic surgery has just been booming. Stuff that you're normally not doing certain seasons has been happening. So I think this is just good dialogue. Shows like that sort of put in people's minds, like, oh, what did they have or what did they do? And they come in and ask about it. So I think it's good for us, right? I mean,
good for us. I just got off a quick Zoom interview with one of the local news channels who were talking about like the Zoom effect, and we're asking me whether Zoom led to more plastic surgery. Like, oh yeah, maybe because you're looking at yourself, but also people are home doing nothing. And they can't travel, and they want to get stuff done.
Well, yeah, the downtime's not an issue anymore. Meaning that people can, they can put the camera far enough back so that nobody can see him on Zoom or sit in a dark enough room or just.
You say, "Oh, my camera's not working today. Sorry."
Yeah, right.
I need a new camera.
Over the camera.
It was good. So basically, it's a perfect storm for us. People are home, they have some money, and they're talking about it on these housewife shows a lot.
Yeah, right. I mean, I think it just plays into what we're doing, and we do it safely as board-certified plastic surgeons. And I don't know who the surgeons are for these housewives, but I guarantee you, some of them are not board-certified, had all the training, doing everything safely. So that's important too when you think about it. from our aspect.
And I'm sure if there was a problem, we would have heard about it on one of the shows. Like, it looks like most of their surgery was done pretty well. I didn't see anything that looked real crazy, any rhinoplasty that looked like it went bad. I mean, it looked like it was done well, and their fillers and toxins looked pretty good too. I mean, I think we're all in the age where the shows on TV are representing us in a more positive light. That people aren't getting big Kylie Jenner lips like a couple of years ago. It's more a little bit more natural looking fillers and toxins that they're doing in surgery.
That's right. I agree with that.
Oh, that's good. Alrighty, guys. Well, I mean, I think we beat this topic down. So, you know, for those of you who are listening, you know, please follow us on YouTube for the plasticsurgerychannel.com, and you know, we're back every other week or so with a No Spin episode. And I wish everyone the best of luck in 2021.